Welcome to Pharmacy View Podcast, where we provide regular interviews with pharmacists and key people within Australian pharmacy and the associated global industry. In this stream of podcast episodes titled RX to Riches, we delve into the evolving global pharmacy landscape, exploring the challenges and opportunities, and examining the current state of retail pharmacy across the globe. With each guest, we discuss the hurdles they face and the potential growth areas that may shape a brighter future for your pharmacy or industry-related business. I'm your host, Michael Alexander, pharmacist, digital health enthusiast, and co-founder of Ottery, an AI-powered communication intelligence platform serving the healthcare industry across the globe. My guest today is proudly brought to you by Shopfront Solutions for all your shelf and digital marketing needs, part of the Arion Technologies Group. Welcome to the RX to Riches podcast. My guest today is Jessica Coppla, who's the Director of Omnichannel Merchandising at CVS Health. For overseas listeners who aren't familiar with CVS Health, it is one of the largest pharmacy chains in the U.S., generating about $100 billion in retail sales a year across nearly 10,000 retail pharmacy locations. So those are big numbers. Jess has worked at CVS for over 17 years, starting as a front store cashier in 2005, and subsequently filling a number of high-level leadership roles, both in retail pharmacy as well as in the CVS corporate offices. She joins me today to share her pharmacy journey and thoughts on the future of the industry. Jess, thanks for being on the podcast.
Thanks for having me, Michael. I'm really excited to be here.
So before we start, Jess just wants to make clear that these are her opinions. She's not here in the guise of actually representing CVS Health. And I think that's really what you wanted to make sure that we make clear to the audience.
Yeah, these thoughts are my own. As an N of one, I do work at CVS, but I have my own opinions, and so those are what I'm sharing here today, Michael.
Great. So, as I alluded to in my intro, you filled a lot of different roles in your pharmacy career, and let me rattle them off. Pharmacy technician, retail pharmacy product development, where we actually met and worked together, store operations, supply chain management, logistics, and now merchandising. So tell us about your incredible journey through the profession and how you came to be in the position that you're in now.
Yeah, great question. One of my favorite things to talk about, I've had a wonderful journey at CVS Health. I started working here while I was in high school as a cashier, just as an after-school job, and never in my wildest dreams did I think that it would turn into a career. But I've been really fortunate throughout the years to move into different roles. I've always had a passion for healthcare and healthcare delivery, and moving into the pharmacy was really able to be an integral part of our community and deliver healthcare to the people around me, the people I live with and see at the grocery store or at the park. And that's really deeply fulfilling work to me. And over the years working in the pharmacy and pursuing my degrees, I then had the opportunity to move into a corporate role while I was getting my MBA or Master's in Business, and started off in pharmacy product development. As you alluded to, that's where we met. We had a great time, got into a lot of trouble. Not really, but we had a really great time figuring out how we could really help our patients across all of our CVS locations be adherent with taking their medications. That's something that is just critically important to the overall health of our nation. And from there, had the opportunity to go into a rotational development program and see some other parts of the business, like store operations, supply chain and logistics, brick and mortar merchandising, and now e-commerce, the digital side of merchandising. So it's been a fantastic journey for me. I've enjoyed most of it, and I'm just super excited to see kind of what the future holds, both for CVS and for me.
Well, before we talk about the future, let's talk about the past. How have you seen the industry evolve over your last 17 years at CVS?
Yeah, huge changes in a very short period of time, right? When I started, even just the technology was things went a lot slower back then than they do now. And the healthcare needs, the needs of our population have shifted for a variety of reasons, right? You have generations that are older than they were when I started working, so for us, we have the boomer generation, if you will, is starting to really age. And we're seeing the impacts of that on healthcare needs. We've also, been through a pandemic as well. among other things. And we've really seen the role of the pharmacy evolve during this time. It's hard to imagine, but I remember a time when we didn't do immunizations in the pharmacy, right? Really the only thing outside of filling prescriptions that we did when I first started was occasionally, doing blood pressure screenings with the old school manual, cuff for patients. And there wasn't a lot of interest in it. But you've seen over the years, the pharmacy has really become a hub for people that need access to healthcare professionals, need advice, need immunizations, need to know what to take when they're feeling sick. And it really goes beyond just the prescription, but we've really elevated what we're able to do now in the pharmacy healthcare delivery setting versus what we were doing, 18 years ago.
Yeah, no, I agree. I think it's definitely been a progression, an evolution, and we'll talk a little bit more about that evolution from the perspective of pharmacists and those working retail pharmacy and how they how they can practice at the top of their profession a little bit more, even more than they have in the preceding last couple of years. But I want to first talk a little bit about your current role. So you're the director of omnichannel merchandising. So explain to our listeners what it means to have an omnichannel approach in pharmacy. And in your opinion, how is this more beneficial in keeping patients engaged in their health?
Yeah, so in my current role, I'm really focused more on the over-the-counter assortment that we offer, but it does tie directly into our prescriptions, and we do have omni-channel programs. For those that are wondering what omni-channel is, if you Google it, you'll see a lot of different definitions, right? But really the way that we think about omni-channel is meeting customers or patients where they are, getting them what they need, when they need it, and how they want it. And that can look very different to different people, right? It's all about convenience. And convenience for me is different than convenience for you. And convenience may be different for each of us depending on the day and what's going on in our lives. And that's where the role of omnichannel really comes in. And it's that ability to get that prescription and those over-the-counter items that you need with it delivered to you today if you need them, in 15 minutes if you need them. Or if you can wait a few days, but you just don't have time to get to the pharmacy, we'll deliver it to your front door. Or if you're coming by the pharmacy on your way home from work and you want to pop in anyway, we can get some of those items that you need together and bring you into the store without having you walk around and pick up those things to save you a little bit of time. So it really varies, and it's all about what does the customer or the patient need in that moment, and how are we going to help them stay healthy? So we're really thinking about this omni-channel or sort of like all-channel approach for how we can get those things to you.
So would you say then that omni-channel really means, in a sense, convenience, or at the very least, trying to find the most convenient way to deliver care to patients?
Yeah, absolutely. Absolutely. It's all about convenience. It's about giving you the options, really putting the ball in your court and letting you decide what's the best thing for you in the moment and then meeting that need.
And definitely the digital delivery channel is going to be a huge part of that, and is a huge part of that already. So I want to talk a little bit about the 10,000-pound gorilla in the room, our friends at Amazon.
Yeah.
Right? So Amazon has made deep forays into the healthcare sector in the U.S., and they have their sights set on pharmacy in particular. So in a landscape where e-commerce and digital health is on the rise, CVS Health is basically a traditional bricks and mortar pharmacy. So how do these traditional types of pharmacies stay relevant and remain relevant in the future? What kind of strategies do they need to employ to compete in the digital age?
Yeah, I mean, it's a great question. It's what I think about, all the time. And for us, what we really want to do, you think about differentiation, and there are two main ways you can do that. You can differentiate with your experience or with your products and your services, right? And so Amazon certainly has made inroads in a variety of different industries, including retail, including pharmacy. They are the ultimate disruptor, and they'll continue to be that. One thing that your brick and mortar pharmacy chain has that Amazon doesn't yet is that location right in the community. We are embedded where people live. And we're also online. You can get to us through the website. You can get to us through the mobile app. So it's the best of both worlds. And I think what we saw over the last, 5 years or so was really this shift to doing everything digitally and mobily. Certainly the pandemic exacerbated that for folks when we weren't able to leave our homes and needed things to be delivered. But now we're starting to see a shift back, right, to this sort of, if you think about how retail started, that general store where you went in and the store owner knew your name, knew what you needed, and took your phone call. And also, if you were sick, said, you know what, I'll bring you that prescription, right? Giving those options, like that's how retail actually started. And there was sort of this personalized touch to it that we're able to deliver along with whatever those healthcare needs are, whether it's a prescription or over-the-counter supplements. We know our patients and we have their trust, and we can deliver what they need in a myriad of different ways. So if they want that sort of less personal online delivery, they can get it. If they want a more personal touch, they can get that too. And so for us, that's really where we're leaning in, being in 10,000 locations across the country. We're within 3 miles of 80% of Americans' homes. So really, like, there's this ultra convenience, and we can build on that with our omnichannel model. So if you want to come to the store, great. And if you don't, we can get you what you need really quickly as well. And for us, that's where we think we can really kind of differentiate ourselves.
Yeah. It's interesting because you spoke a little bit about personalization and having that ability to know the patient when they walk in. When I was practicing as a pharmacist, I would take pride in knowing my patients and asking about their families, and that personal touch. And I think a lot of the health professionals who are listening to this podcast would agree is so important to the overall delivery of health. But on the other side, now we have things like generative AI. You can go online, put in your symptoms. They can tell you they can tell you what you have and point you in the right direction. Then you can order it online, and you never have to leave your house for any of it. So I'm just wondering, in your opinion, is that level of personalization, does that still matter to patients, or is that going to be diluted in the future as these technologies tend to get better at interacting with patients?
Yeah, it'll be interesting to see how things evolve as generations age, right? There's certainly more of a preference to, for Gen Z, a really digitally native generation grew up with tablets and smartphones, right? Whereas millennials remember a time when there wasn't such a thing as a smartphone, and cell phones were these huge things in a bag. And then, Gen X before that, right? And so as we all age, I do think there could potentially be a shift. Generative AI is really interesting, a buzzword right now. Everybody is talking about it, and you're right. It's very immature at the moment. It will get a lot better. And there are going to be people that enjoy talking to a chatbot or prefer talking to a chatbot versus a person. We know that, right? But there are still a lot of people, particularly when it comes to healthcare, that want to talk to a person, whether it's talking to that person face to face at the pharmacy or through a telehealth appointment. Seeing another person really just sort of adds that personalization and also increases that trust factor when you're asking questions, especially related to your health. Do you want Olivia the chatbot telling you what to do versus Michael the pharmacist? I don't know. Different people would answer it differently. I certainly would prefer to hear it from Michael. And I know that a lot of people out there, at least currently, would as well. But we'll continue to evolve as our customers' needs evolve.
Well, I appreciate that. Sorry, Olivia, the chatbot. But I wanted to ask you something that you said when we were prepping for this conversation, which I thought was really interesting, and it has to do with a lot of what we've been talking about in terms of different channels and how they can tend to reinforce each other. But you said that digitally initiated sales have a halo effect. So what do you mean by that?
Yeah, so it's really a very interesting concept. But what we have seen over time, as more people have gotten comfortable, using their cell phones, we're really in an age where you've got your phone right by you at all times. If it's not in your hand, it's within reach. And what we're seeing a lot of is not only are people making purchases online, they're more comfortable making purchases that way, desktop, mobile, using a URL or using an app. But more than that, what we're seeing is people are doing their research online to decide what products they want to get. They're checking the prices, they're checking the promotions, they're checking where they can get things, maybe where's the closest place they can get it, or how's the fastest way that they can get it. And then they're coming into the store and they're making their purchases, or they're placing an order online. And for programs like Buy Online, Pick Up in Store, which are getting a lot of traction in the United States, what's happening is that's driving foot traffic into our brick and mortar locations. And what we're seeing is that most people that come in to pick up an order then end up grabbing another product before they leave, or a handful of products, and adding another $15 to their basket. And so when we look at our sales, they're great, but then we see the impact of those sales and what they drive into our brick and mortar channel is 3 times as much. And we're able to track that with analytics. So really, really fascinating. That makes a really good case for why we should continue to grow in this sort of omni-channel space. It shows, it proves people want to be able to get things in more than one way, and it's good for the business and good for the bottom line. So that's the halo effect.
Yeah, no, I love it. I might steal that. I'm just telling you now, Jess. Uh, let me see. Let me talk a little bit about the role of pharmacists in the future. And we touched on that the role of pharmacists have been evolving over the last couple of years. To your point, and I remember very early in my career, there wasn't much we could do in the pharmacy. Now there's a whole host of different types of services that pharmacists can provide. So from your lens, and as somebody who has kind of worked across the industry in multiple different situations, not being a pharmacist yourself, but working with pharmacists all the time, how do you see the responsibility of pharmacists changing in the coming years? And how does CVS support that development? And I guess as an add-on, what are new kind of revenue streams that that we can start to create that, can reinforce some of these changing responsibilities?
Yeah. We've already seen a little bit of that, right? With the pandemic, not only, we were delivering vaccines before the pandemic, we were doing flu shots, shingle shots, pneumonia shots, things of that nature. And of course, we added COVID vaccines. Beyond that, we started doing COVID testing. So screenings, doing those through the pharmacy. I think we're going to start to see a lot more of that for a myriad of different, healthcare needs. Obviously, I think we'll continue to expand vaccines. We're starting to see more RSV and things of that nature, monkeypox, right? Beyond those things, I think that, the research shows, I was reading an article the other day that people talk to their pharmacists or their local pharmacy team 10 times more often than they talk to their PCP, if they even have one, right? And so your pharmacist and your pharmacy team are really available to you to help with that. And I think that the future includes really leaning in there and seeing what other things we're able to do, whether it's the ability to prescribe, based on screenings. Hey, your symptoms really suggest you have this thing, and common antibiotics potentially can be prescribed by the pharmacist, or birth control could be prescribed by the pharmacist, things of that nature. I think we're going to start to see more of that over time. And I think we're also going to start to see pharmacists more involved in telehealth as well. So that if you can't get to the pharmacy, but you need something and you really do want to have that sort of face-to-face, albeit virtually, we'll have the ability to set up those appointments. And that would be another, revenue stream for us as well, potentially.
And on the flip side, where do you see are the major challenges for traditional pharmacy? We know that there's pressure from the Amazons and the strictly digital players. although I think we can all agree they can't do everything. I think we talked about that and generative AI. And I was just reminded, uh, a friend of mine was telling me just the other day that he had gone into one of those generative AI platforms to diagnose his symptoms. And the platform said it was 98% sure he had glandular fever, and it turned out he had the flu. So, there is a long way to go. From just to your point from before, there's a long way to go before we get parity with walking in and talking to a pharmacist. But these technologies are coming; they are posing a challenge. And it's not only that. There's an aging population, which has its own benefits plus challenges for pharmacy as well. So I'm just curious from your standpoint, what do you see as the biggest challenge to traditional bricks and mortar pharmacy, and how do we alleviate some of those challenges, possibly with an omnichannel approach?
Yeah, I think the one of the things we talk about a lot is lifetime value of a customer, right? And so at CVS, for example, we have a loyalty program, the Extra Care Card. 74 million people have one. It's one of the largest loyalty programs in the United States. And what's happening, what we're seeing a lot of is, families they share an Extra Care Card, and that's great. But then, when the children in the family turn 18, they're not necessarily getting their own card, or they're not necessarily shopping the same way at CVS as their parents do, or as grandparents do, or other older family members. And so that kind of combined with some of the other pressures we're experiencing in the industry, like real margin pressures, real scrutiny from the insurance side, trying to go lean and really not prescribe when it's not needed, things of that nature. We're seeing that lifetime value of customers going down for younger generations. And those are the people that are going to be shopping, for the next several decades. So that's something we're really trying to figure out is how do we, we're talking a lot about meeting people where they are and giving them what they need in this omni-channel approach. And how do we also do that like multi-generationally? We can't be everything to everybody. And I don't think that anybody can be at the moment, although maybe, generative AI will figure it out at some point. But we really have to figure out how we can be compelling, how we can be differentiated enough to these different generations to sustain this lifetime value and keep our patients coming back and deciding to use us versus a competitor over their lifetime.
Yeah, I think that's a really great point. Capturing the lifetime value in a way, as you said, that you are basically with them generation on generation, and that trust builds across the decades. That is really super important to really counteract and counterbalance, especially the technological side or the very impersonal at this point technology that can be leveraged, to replace some of those services. So I really agree. I think that's a really good point. I wanted to talk a little bit about, because I had left CVS by the time the pandemic hit. So I just wanted to maybe rewind a few years. And as we're talking at the moment, there is yet another sort of mini surge of COVID cases with yet another type of variant. So as somebody who was working at CVS through the pandemic, take me through what it was like in really CVS is at the forefront of a lot of this, especially with flu immunizations and things of that nature and testing. Take me a little bit through that experience, and then maybe talk to me about how well you think we're set up, especially from the perspective of the pharmacy industry, for the next pandemic, if it comes.
Yeah, I mean, the first time around, you missed all the fun, Michael. And it was a lot of fun and a lot of long days. We talked a little bit earlier about convenience and sort of the placement of brick and mortar pharmacy chains in the communities, being near people, being accessible. And so that was really critical when we were trying to get out treatment, getting out prophylaxis and screenings and prescriptions to people that were infected, being in the neighborhood, being near people, and being able to partner, with the government and with pharmaceutical companies that were making these vaccines and these test kits and moving inventory around really quickly to thousands of locations. It was not easy. There were a lot of learnings, and I think for a lot of organizations that thought they were ready, it was a big learning. You don't ever fully know what it is going to be like until it happens, and so we really had to kind of come together, bring together a lot of task forces, working a lot of days to figure some of this stuff out, the technology aspects of it, how to be compliant, do everything legally, and still do everything quickly. And so I think it really brought a lot of companies forward in terms of their omni-channel capabilities. For us, being able to do a lot of the ordering or scheduling of appointments for vaccines online first, and so that there was a queue, and when you showed up, the pharmacist knew to expect you. That really made things much more efficient. But it was all a learning curve, right? And figuring out, what was billable to insurance versus what was being paid out of pocket, and things of that nature. It was definitely a journey, and it wasn't necessarily always smooth, but what we've learned from that, I do think, positions us much better, at least, than we were, say, in December of 2019, to address the next one, whatever it is. Will it be perfect? Probably not. There are just some things you don't know, that you don't know, right? But we're in a much better position now with the capabilities that we have from an omni-channel perspective, to deliver at least a framework that should help us with whatever comes next.
Well, it leads me to my next question, and this is something that I know I struggled with when I was at CVS Health, and it makes sense because we're kind of sitting in the corporate headquarters, and there's 10,000 retail locations across the entire United States. I don't know if there's one state that doesn't have a CVS. Maybe there's one or two. I can't remember, but I feel like they're pretty much in every state. How do you figure out what's working and what's not working when you're pushing some of these initiatives, or when you're trying out, especially under circumstances of COVID, you're kind of launching these strategies? How are you getting feedback? How are you figuring out what works and what doesn't work? And what kind of strategies could pharmacy owners who are listening to this podcast, maybe even, a much smaller scale, they may only have one, they may only have two or three. What kind of strategies can they then use to understand what's happening in their own little ecosystem?
Yeah, I think that there are really some things that kind of would hold true whether or not you've got one location, 100 locations, 1,000 locations, or more than that. Really critically important in these dire times, you have to be able to move quickly, and you have to be able to recognize failure when it's happening and move on from it quickly. Be okay with that failure. That's how we learn. So you need to be able to test. Communication is critical, right? Communication is critical regardless of the size of your organization or the size of the workforce that you're trying to mobilize to get something accomplished. And you need to be able to have a two-way forum to hear from people how things are going. So you really need to dedicate time and resources to going through that feedback, addressing things as they come up. If you have a help desk that can take calls and take feedback, and route issues, to the right departments to help resolve that. If it's something like technology related, right, that's all critically important. And it's super important if you are in a larger organization to make sure that you have a field structure with field leadership that can be boots on the ground. If you're not able to travel from wherever you are to the locations to see how things are going firsthand, you need to have a support system that is. And you need to have people that can champion whatever it is that you're doing, recognizing that you've got a good goal. How you get there may need to change over time. And often the most helpful feedback that we get is from the people on the front lines delivering it. They're the ones that truly see what's working and what isn't for our patients. And so really being able to prioritize that feedback and then action on it is just incredibly important to evolving whatever it is you're trying to accomplish from a concept to something that's efficient, sustainable, and even potentially profitable.
Yeah, I think it seems that the same skill set is required in terms of open lines of communication and setting clear goals, working towards those goals, having some sort of feedback mechanism, whether it's one pharmacy or 10,000 pharmacies, so you just have an understanding of how your strategies are translating to boots on the ground. I think to your point, those are the same skill sets and same skills regardless of size.
Yeah, and it sounds simple, right? And having KPIs and having analytics and the ability to measure how you're doing and are you tracking towards success and then addressing if you're not, it's easy to say, right? But as the former owner of many scorecards and lots of digital, sets of analytics on thousands of stores, Michael, we did a lot of this in product development when we were there around patient adherence programs. It's not a small feat, at least not for, a large organization, but even with a smaller one, really the ability to take whatever the results are telling you and do something with it and do something quickly. It's almost always easier said than done, but critically important.
Yeah, and let's talk about that for a second, the analytics. And you're right. We saw a lot of data, and I'm sure you are inundated with data from across the entire organization. And I personally, I have a theory of diminishing returns with data and analytics, that you can get to a point where it's not really telling you much of anything. And you just need to start to maybe narrow your focus to maybe 3 or 4 key performance indicators and just really use those to drive the business. Agree or disagree?
Totally agree. I think the saying is death by 1,000 cuts or death by 1,000,000 cuts. And you can certainly go down all kinds of rabbit holes with the data. And so often when you do that, you don't get good results like you were saying, Michael. So I absolutely agree. It's critically important to keep it simple. Defining, what those key KPIs are may take work in the beginning, should take work in the beginning when you can get, hundreds or thousands of different metrics. They're not all going to be important. So you really do need to figure out which ones are important to you. And then as time goes on, you need to be able to really kind of quickly assess whether or not you're right. Were those the best 4 things to measure? Should it be different? And being really kind of purposeful throughout that process. It's hard, but it's really important. Yeah, and the kind of simpler you can keep it, often the better the execution is going to be.
Yeah, I agree. And I think part of it as well is, does this pass the smell test? I remember, you may not remember, but I remember we were working on a project where we were collecting data from the dispense system. And there were a couple of metrics which were kind of really, we were surprised, a little bit out of whack. And I think you figured out that some of the staff were kind of gaming that metric a little bit, or there was a way to game the metric in the system that we weren't aware of. Because I hadn't worked, in the retail pharmacy. So how do you kind of see through that, through that fog? Because sometimes, they say the data doesn't lie. Data lies all the time, frankly, as far as I'm concerned. But what's your process in kind of seeing through that?
Yeah, that can take different forms depending on what it is that you're trying to accomplish, and so for what you were just mentioning, I remember one of my first projects when I came into corporate was to deliver colleague level data on, various things that we were kind of pushing at the time from an initiative standpoint, and essentially being able to measure, whether or not colleagues were doing the things that they were saying they were doing. And as somebody that had spent 12 years working in the stores prior to coming to corporate, that did not make me a lot of new friends and probably lost me some existing ones, at the time. And I could completely understand the workarounds having lived it. and being under so much pressure to deliver so many things in such a little amount of time, you are always kind of looking for ways to get things done faster, or right, wrong, or indifferent shortcuts. So I think it really depends. In those particular instances, there were some repercussions, right? Kind of like from a fraud, waste, and abuse standpoint, if we were claiming we were doing things that we weren't. And so it was critically kind of important to really get granular and see where there were potentially, coaching opportunities, to address some of those things. Now, that's not the right model for everything that you're doing. And so you really kind of have to decide, like, what's the right level of measurement. If you've got one store, that's different than if you've got several. And maybe you decide, to measure, we kind of break down our large network of stores into sort of different groupings, like districts, which are sort of, the local, surrounding towns. And then there are regions, which are larger. Maybe that's a state or a couple of states. And then there are areas that's like the Northeast and the Southeast and the Northwest and the Southwest. And so, we decide, like, how do we want to sort of cascade down and measure up based on whatever, it is that we're trying to accomplish. But it's different depending on what you're doing.
Yeah, and I'm always fascinated talking about the cascading down or from the kind of the surface up, how innovation happens, particularly in these types of environments. I'm just wondering, and I'd love to get your perspective on this, is innovation possible in a busy pharmacy? So again, my personal opinion is that innovation doesn't happen, in a boardroom in the ivory tower or somewhere in one CVS drive. Apologies to my CVS colleagues from previously. I mean, there's a lot of good strategies, obviously, and a lot of great ideas, but the true innovation, I think, happens in the pharmacies with the pharmacists and pharmacy technicians working day to day, trying to figure out ways to do things a little bit better, a little bit more efficient. But we know how busy the staff is in the pharmacy. It's just nonstop, answering phones, dealing with customers, dealing with drive-in, prescriptions online. Is innovation possible in that type of environment, in your opinion?
Oh yeah, I think the most innovation happens in that environment, because that's where it's needed. Because it's not innovating to innovate, it's innovating to survive. And certainly, a lot of times when we are trying to think through in a corporate setting the next best thing, we lean on our store colleagues and our pharmacy colleagues for feedback. We really value that. We try to have a feedback loop. We have forums, we identify champions, we bring people into the corporate setting to test things with us in our, sort of mock pharmacy that we have, and get their live feedback around whether or not they think that this is a good idea or that patients will like these things. We do training videos with colleagues that work at CVS. We're not hiring actors to do them. And in those training videos, when people are reading the scripts, you get some really interesting feedback. And it's critically important, right? And so we try to hear as much as we can, from our stores around what's going on, what's working, what isn't, what the ideas are. We have hackathons. Now we give colleagues the ability to sort of submit ideas on a pretty regular basis. And, as you can imagine, with hundreds of thousands of colleagues, there's quite a lot of feedback, and sifting through it can be daunting and probably an opportunity, to do better. But we do have a ton of innovation, that really is born out of necessity or just from the people that are on the ground and are really, really passionate about these things. They've got great ideas, and we take them as often as we can. And conversely, there are a lot of us in the corporate setting that did work, in the pharmacies and in the stores. And so we lean on that experience as well, and we lean on our networks of friends that are still in the stores to get their opinions as we are thinking about innovating, so that we're not kind of just putting stuff out there that looks good on paper, but ultimately doesn't really work out the way that we thought it would.
Yeah, I think that's really, really nicely put. And innovating to survive might be the new motto for pharmacy writ large, actually, because that's what we need to do: survive, just innovate and keep driving forward. Well, let me ask you this, kind of to close the loop. What advice would you give someone looking to have the sort of really varied, interesting career that you've created for yourself in pharmacy? I guess an adjunct to that question would be, did you have a plan going in, and did you stick to the plan, or how did it all unfold? And if somebody is listening saying, well, I want the career Jess has, how is that possible?
Yeah, this was not my plan. I don't know that I necessarily had a plan. When I was 4 years old, I desperately wanted to be a hairdresser or a doctor, and I'm neither one of those things. So, I would say this probably wasn't the plan. I certainly didn't see myself, working in corporate America. However, it has been a wonderful career. I've had just fantastic opportunities, and within the organization that I work within, you can have so many different careers within a career, and I have had many so far. And the way that I got here and what my advice would be to others who are interested in diversifying or trying new things is to not be afraid to say yes. And that doesn't mean to say yes every time you get tapped on the shoulder to do something. You should be selective. And when the opportunities arise, you should think about whether or not it makes sense for you. Is it something you're really interested in? Is it going to give you exposure to parts of the business that you want to learn more about? And if it ticks off the boxes for you for whatever those priorities are, then don't be afraid to say yes. I could have stayed comfortable, as a pharmacy technician. I loved being a pharmacy technician. I did it for 10 years, and I miss being in the community and delivering care to my patients all the time. But because I wasn't afraid to say yes to other opportunities, I've now expanded my horizons and been able to learn so much about so many different parts of the business that I really value, and I think really sets me up to continue doing that, for years to come. So don't be afraid to say yes.
I think that's wonderful advice, and I'm sure you'll continue to have an amazing career trajectory. Wish you all the best, Jess, and thank you so much for joining me today.
Thank you for having me. It's great.
Thanks for joining us today on the Pharmacy View podcast. And don't forget to like, share, and leave a comment if you found this episode of value or have any feedback. Podcast episodes are promoted through social media, LinkedIn, YouTube, and major podcast mediums. And each episode can be found on the Pharmacy View webpage with links to guest contact and business details. If you're a pharmacist or industry support supplier and would like to join us on an episode, send us a message through LinkedIn or complete the inquiry form on the Pharmacy View webpage. I'm your host, Michael Alexander, pharmacist and co-founder of the communication intelligence platform Ottery. On behalf of Shopfront Solutions and Arion Technologies, thanks again for joining us today on the Pharmacy View podcast.